Perfect. Hi, all. Thank you guys so much for attending. I'm Blair Hanosh. I am a registered dental hygienist as well, and I currently practice as a specialty regional manager, like they said, in the Rocky Mountain region, which is Colorado, New Mexico, Utah, and Idaho, supporting hygienists, specialists, doctors with perio and endo as well. So I'm really excited to be here, and I'm really excited to present to you guys, especially like Angela said, with the pandemic going on right now. This is a great time to really focus on the mouth-body connection. So we're excited to be here.
All right, Angela, can you click us to the next one? Here we go. All right, so today we're going to be talking about what we call the mouth-body connection. And I think we all know that the mouth is connected to the rest of your body, but some of the specifics of ways that you can use that in your practice, we want to help you guys identify statistics from current research so you can talk to your patients about how the mouth and the body are connected in terms of their health and what you can do for them. So we're going to be talking a lot about some statistics, and then we're also going to be talking about how to use those in real-world situations with your patients. And I think go next, there we go. Yep, excellent. So according to the CDC, these are the 8 leading causes of death in the US, I believe. So the first is heart disease and heart attack. Next is cancer, then respiratory diseases, accidents, stroke, Alzheimer's, diabetes, and influenza. We can, as dentists and hygienists, actually affect some of these causes of death. And I think not only death, but also just suffering. A lot of these things don't just kill you, or don't just kill people. They cause a lot of suffering, especially in our older population, that we can really influence people's lives for the positive.
Yeah, and to add to that list really quickly would be COVID-19.
Yes.
I know you guys have all heard about that. And just being able, we know that with the bacteria in our bodies, and obviously we have it in our mouths, the severity of COVID-19 only gets worse if we have that kind of bacteria. So let's try to hit it at the start.
Absolutely. There was actually a study that came out fairly recently that linked periodontal disease to needing a ventilator when you have any kind of pneumonia. So it wasn't specific to COVID-19, but of course, ventilators are something we're hearing about a lot in the news. And, you know, I don't think I can, I guess most of my day I go around thinking, you know, I'm just a dentist, I'm here to fix teeth. But this is a way that I think if I can get one person in my community to prevent needing a ventilator if they do get COVID-19 and leave that ventilator available for someone else, that's one tiny way that I think I can really kind of save the world as a dentist right now, and you can save the world as a hygienist. So if we can work together as a dental team to keep people out of hospitals and off of ventilators, I think we're doing our part to help curb what's going on right now. All right, so that first cause of death was, leading cause of death was heart attack and heart disease. And this is something we're gonna be talking about a lot today. Many people know what atherosclerosis is, but I just wanna go over a little bit of the process and how that relates to periodontal disease, because that's what we're gonna be talking about quite a bit today. So plaque is very silent at first, and we're not talking about dental plaque, but plaque in your arteries. As that plaque accumulates, there's an inflammatory response in our vessel walls to that plaque. And then there's going to be, at some point, a possible puncture in an artery wall. Now that comes from that inflammatory response, which can be kicked off by many things. One of those things is the bacteria of periodontal disease. Once that artery wall is punctured, that blood clot goes flying through those arteries and lodges somewhere. When it lodges in the vessels that serve the muscle of your heart, it causes a heart attack. And when it lodges in a vessel that serves a part of your brain, it causes a stroke. So really a heart attack that happens in your brain is a stroke, and a stroke that happens in your heart is a heart attack. But if we can knock down the bacteria from periodontal disease, we can eliminate one of the factors that would make that plaque go flying. So that's what we're really focusing on in terms of the link between heart attack and stroke. And it's such a strong link that's being now related, not just in a correlation, but in a causal way between periodontal disease and heart attack.
Yeah, and if you don't mind if I could step in for a second, with the key prevention through early detection, when are we probing? I mean, that's the very first thing we need to do is, to assess our patient. And by assessing our patients, we need to do a full exam on our patients and probing. So a lot of people say, oh, I'll probe when the patient's a new patient. We should be probing a minimum of once a year. And for me personally, I try to probe my patients every single time they come in. I treat every patient as though they were a new patient. Their mouths were new to me. So I can evaluate and assess their current, if it is their health condition or their periodontal condition. So being able to probe every time they come in is really key to the early detection of the disease. So, and one of the big things is a patient comes in on the schedule and it's a prophy. And I think as hygienists, we tend to have blinders on. I know I have in the past, and it's once a prophy, always a prophy. And we need to get that mindset out of our heads, because it's not, it changes. The patient's health will change day to day and month by month. So really being able to assess the patient every single time they come in and doing a full mouth perial evaluation on these patients is extremely important.
Absolutely. And I think, Blair and I talk a lot about making sure that you have a protocol in your office for when people are probed and how often people are probed, and that someone's helping keep accountable to make sure that we are keeping up with that. And if that's the hygienist, if that's the dentist, I think it's really important because, like Blair said, at some point people develop periodontal disease. It's not like you are locked in because you came on one day and that was okay. So that continual evaluation is really important to make sure we catch it once it shows up, because it's easiest to treat when it's really mild. So some of these end stage events that occur with that arterial rupturing, we talked about heart attack and stroke. There's some links now with vascular dementia, with kidney disease, worsening of diabetes. We have periodontal disease linked with erectile dysfunction. So there's a whole bunch of stuff that goes on. And I kind of giggle about that erectile dysfunction portion, but it really is something that I actually talk about with my patients. And I do it in sort of a mild, joking way. But I do get some ears that perk up when I talk to people. So I'll just, when I start talking about periodontal disease, I say, gum disease is linked to many health conditions in the body: heart attack and stroke, dementia, diabetes, low birth weight, erectile dysfunction, a lot of stuff. And you just kind of throw it out. But if that's what's going to get your patient's ears to perk up and listen to you, I think it's something that's worth mentioning, even though it might be a little uncomfortable. All right, let's see that next one. There we go. So patients with periodontal disease are 24 to 35% more likely to develop plaque in their arteries. So not only does the plaque destabilize does the bacteria destabilize the plaques, but you're more likely to have the plaques. This is particularly interesting to me because my mom had decided not to mention to my father, who is a physician, that she was having blindness that was coming and going in one of her eyes for like a week. And by the time they went to the hospital, her blood pressure was like 250 over 150. And what she found out was that she had a 90% occlusion in one of her carotid arteries. And what she was experiencing was TIA, or like a small stroke. So go ahead and figure she has gum disease, and so do I. So it's something that I'm thinking about with my own health, something I think about with my family's health, is making sure that these plaques don't develop in my body as much as I can, and that I'm treating my own periodontal disease in my mouth and encouraging my mom to treat hers too. I want her to be around. Patients who brush less than twice a day are at much higher risk of suffering a cardiac episode. And I wish I had a source for you, but I don't. But I read somewhere right after I graduated dental school that the average American brushes their teeth once a day for 47 seconds. Even though we've been saying 2 minutes twice a day, 2 minutes twice a day. So most of our patients are at much higher risk of suffering cardiac episode. It's not just you scraping the tartar from below their gums and getting the infection out, but it's also how you talk to them about oral hygiene and encourage them to do it. Blair, how do you like to encourage your patients in their oral hygiene?
Yeah, it's the 47 seconds. I smile at that, but it's so true. You think about it, even yourself, when you're brushing your teeth, it's like it foams up and you're done. You're done. As well as flossing. Flossing's a big one too. When I talk to my patients, I try to connect with them. This is a really important time when you can connect and get that trust, build that trust with your patients. So I know hygienists have a tendency to lecture patients. This is the time where we have to step back, and instead of lecturing our patients, try to educate them, get some information from them. So my conversation with them is, so tell me a little bit about your home care. How often are you brushing? Usually they'll tell me twice a day. And then I'll ask them what they're using. Are you using a regular toothbrush or are you using an electric toothbrush? I highly, highly recommend, and I believe you all do too, electric toothbrushes. It takes a lot of the thought process out of brushing with all the angles, with the pressure, with the time. It's a lot of people will think about it and then they'll throw it out the window and continue doing what they're doing. So it takes a lot of the thought process out of brushing. When it comes to flossing, it's always interesting because you ask a patient how often they floss and they pause for a second. And in that pause, they're actually thinking of a lie to try to figure out, okay, what does she want me to say? And so I try to interrupt them real quick in their thought process and say, once a year, twice a year. So to let them know that, hey, it's okay. Just be honest, and I'm not going to beat you up for it. They'll usually tell me once a week, twice a week. And I always let them know, listen, this is what I do. I'm not perfect. I may be a hygienist, but I'm definitely not perfect. I honestly feel like I floss everybody else's teeth, so I should have sort of a dispensation from flossing my own. Unfortunately, that's not how it works. But I'm just as guilty as you all are. So letting them know that it's okay and giving them the feedback to say, I only floss once a week. I only floss this time. And then giving them the information to go, okay, so let's try flossing, a couple times a week. See how you do it, and then move up another time a week until you get more in the habit of it. I also recommend myself brushing and flossing in the shower. I hate to get the mirror soaked with all that stuff, and then I have to clean the mirror after. So not only am I not excited about flossing, but I also have to clean the mirror after I'm done. So I usually always floss and brush in the shower. So just giving them some helpful hints will help encourage them and will really build that trust.
Absolutely, and I think part of what I'm hearing from Blair is it's about building up a patient instead of knocking them down and lecturing them, and kind of getting it baby steps at a time. I mean, I had a patient once. We talked over and over and over about brushing, and he said, I got this electric toothbrush, and I'm looking at his mouth. I mean, I just don't believe he has brushed his teeth once since the last time I saw him. And I said, I gave him a mirror and I gave him a toothbrush, and I said, can you show me what you're doing? And he closed his teeth together and he went, and I went, okay. So I'm really happy you got the electric toothbrush. I'm really happy you're putting your toothbrush in your mouth every day. The next step is to open your mouth while you're brushing. So sometimes it's tiny things, but if you go at him and say, you got to do circular brushing and get the, floss in there and water picking it, he's just going to go, this is overwhelming. I can't do it. So building that up bit by bit is really what's going to help your patients understand what's going to keep their plaque control better, which again is going to link back to this heart disease stuff. So circling back to heart disease and now also stroke, tell me, everybody, please shout out any questions you have. Does anyone have any questions for us about heart disease? You can put them right in that chat box and we'll answer them. So don't be shy. We'll talk a little bit about stroke while you guys are thinking about your questions. So periodontal disease is associated with a 4.5 times more likely to suffer a stroke. That's 450% more likely to have a stroke if you have gum disease. And the worse your gum disease, the greater the risk is for stroke. And this is where I think we can help really knock down a lot of the suffering. I know we talked a little bit about death, but a lot of patients survive a stroke and lose the function in part of their body, in part of their face, in one of their arms or legs. And if we can help people maintain a great quality of life just by doing what we already know how to do. I mean, we're not talking about learning how to place implants here. It's just making sure patients have good plaque control and that we're doing our job with their periodontal maintenance. All right, let's see our next one. There we go. Okay, so we got a little more statistics to go here. We've got some periodontal disease and diabetes. So patients who have periodontal disease and diabetes are 320% more likely to have diabetic kidney disease and ischemic heart disease, also known as heart attack, or the precursors to heart attack, if they have diabetes. There's also correlation with reduced control of A1C. I have a lot of patients who come in who are diabetic, and the way I talk to them about it is to say, hey, I noticed that you're taking some medications for diabetes. How happy is your doctor with your diabetic control? And they'll go, oh, they're always on me, Well, what's your A1C? Oh, it's 7.5. They really want me to get it down. Okay, well, one thing I can do that all you have to do is lay there. Just let me treat your gum disease. And I think your doctor will be happier with your diabetic control. You don't have to go on a diet. You don't have to do anything. You just have to let me fix this and floss. And I get a lot of patients who will kind of buy into that because they're already on a plan to help reduce the negative stuff that's going on in their diabetes. Being a dentist and a hygienist and as a part of that, we can really be a partner in that team. We've got a great question. All right. Do patients with healthy tissue on a reduced periodontium due to periodontitis experience the same risk, reduced risk, or something in between? That is a fantastic question. They're finding, and we'll talk some more statistics later, but patients who have improved control have reduced risk. I don't know if it's reduced all the way down to that of someone who doesn't have the condition. I have a feeling it's not, because a lot of us who have periodontal disease, including myself, have some genetic risk factors about inflammation and inflammatory markers in our bodies that probably also contribute to the risks of these conditions. But there's some great studies out there that show that controlling the perio definitely reduces the risk of these conditions. So yes, absolutely.
Yeah, and there's no way we can cure periodontal disease. It's not curable. So that bacteria, regardless if it's at a maintained state or not, is still active. And we need to make sure, that's why the recalls for perio maintenance and possibly doing scaling and root planing. Just because they've had scaling and root planing once doesn't mean that they will never receive it again or never need it again. It's not a once in a lifetime. It could be, but it's not always a once in a lifetime. So making sure we're following up with those perio maintenances and not putting these patients on 6-month appointments. Really getting, because we know that the 3-month mark is a serious mark. That's when the bacteria after that becomes more aggressive and it becomes active. So if we can help the patients and partner with the patients in keeping that level of bacteria to more of a maintained state, absolutely. But unfortunately, as we all know, periodontal disease is not a cure. There's not a cure for it. So that bacteria is still going to be in the mouth.
Absolutely. And I think that's why I don't stop probing. And I know, Blair, you don't either. I don't stop probing once we've diagnosed gum disease. That was one of the big sort of aha moments I had in my career when I was crafting a protocol for how to deal with periodontal disease at my office. I realized that we tracked people into, you have gum disease, you get your SRP, you come back to maintenance. And that was the end of the protocol. And that's a stupid place for me to end that protocol. So you get your SRP, you come back for maintenance, and then we're going to track you into 3 different areas. And I use a red, green, yellow traffic light system. So the red, you're doing poorly with your control are the people who've got, 5s and 6s that aren't resolving, poor plaque control, bleeding everywhere. Those people I try to control with the things that I have at my disposal. And then if it doesn't work after a couple PMVs, I send them to the periodontist. My yellows are the ones that are always going to be on a 3-month PMV because, unless things change, but those are people who are going to keep on a PMV because they're kind of okay, but not doing that great. They've got a bunch of 4s and bleeding and plaque, but maybe not, we're not getting worse. And then my greens are the ones that we're bumping out to the 4-month PMV and saying, well, we barely have anything clean in here. Let's keep you maintained and keep probing you because things might change. But I think that's an important distinction to make because people who have a chronic disease like periodontitis, I make that link with diabetes for patients all the time. I say, look, sometimes your sugars are better, sometimes they're not so good. We're going to find times that this fluctuates throughout your lifetime. It's going to fluctuate with stress. It's going to fluctuate with changes in your hormones, like when women go through menopause. It's going to fluctuate with any kind of fluctuation in your body. So I think it's important to keep evaluating patients and keep talking to them about what that evaluation means for them. All right, periodontal disease and Alzheimer's and dementia. So, I love my percentages at this point. So patients with perio are 260% more likely to develop Alzheimer's disease. That is terrifying. Alzheimer's dementia are also related to tooth loss. And this is something that I think, I believe with my whole heart that reducing the inflammation and bacteria in the gums is going to help prevent diseases in the body, or at least prevent events from diseases that are already there in the body. In addition to that, not only is tooth loss a problem for periodontal disease, and we all know that, but whole mouth tooth loss, edentalism, is also correlated with dementia. So even if all you're believing is that you're saving teeth and keeping them in the mouth, know that if you avoid putting your patients in dentures, you're helping them avoid dementia. I think this has a lot to do with people being able to get adequate nutrition in their body when they don't have teeth or don't have enough teeth. So it's really, this one is also personal to me. My grandmother is 94, she's still kicking, but she has Alzheimer's disease. And I got a very upsetting email from my aunt today that her disease is progressing, and it's really scary. And I think that, again, she has periodontal disease as well. But if I can avoid myself getting that condition, if I can help my older patients avoid getting that condition, anyone in my family, if their dentists are helping them with their gums, I don't want anyone to suffer the way my grandmother's suffering. So I want to help keep my people healthy. I just want people not to suffer. And doing what we do is what's going to lead in that direction. So knowing that you're 2.5 times more likely to develop Alzheimer's disease, I can't tell you how many times I have thrown that out to a patient, and all of a sudden, they're staring at the wall going, yada, 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 you're talking about my gums. Oh, wait, what? What do you mean, dementia? Oh, I don't want that. Yes, you don't want that. Let's talk about how to prevent it. It's very easy at my office. It's very easy at everyone's office. It just takes a Cavitron.
Yeah, I think all of these that we're talking about today, it's very eye-opening, and it is eye-opening to patients. And I know that this, you see an article every other day or every day or maybe every hour that comes out about a new condition that is linked to periodontal disease. And again, going back to the early prevention or maintenance of it is absolutely 100% key. And being able to use adjunctive procedures, which we'll get to in a little bit, to help with the maintenance and the prevention of these. And like you said, Dr. Sasse, utilizing the periodontist, whether it's in your practice or outside, really key, because there are limits that we as hygienists can do, and they can, we obviously don't do surgery, so they can do that surgery to help reduce the pocket depth, to make it easier for patients to be able to clean those areas. So yeah.
Sure. Yeah, absolutely. And our next topic is periodontal disease and pregnancy. Now, I happen to have two pregnant hygienists at my office right now, so this is way high on my list of things to think about. But whenever I have a pregnant patient come into my office, I always talk to them about gum disease and its links with preterm birth. I give a 30 to 50% higher risk of preterm or low birth weight when you have periodontal disease. It is 3 times higher risk than those with only gingivitis, and 8 times higher in the, I'm sorry, the risk is 3 times higher in moms with gingivitis, and then it's 8 times higher in moms with moderate perio. So this is another thing where, back to Anna's question about, is the risk reduced when we control it better? Here's the flip side of that, where the risk is increased when we control it worse. So I think it's absolutely essential that our pregnant patients get their gums treated and maintained. You know, a lot of people are really hesitant to come to the dentist when they're pregnant because they think it's going to be dangerous. Really, we know for sure that it is more dangerous to avoid the dentist during pregnancy than it is to show up.
Yeah, and the communication to our patients regarding this is key, because a lot of patients will hear when you say, you know, you have a higher risk or periodontal patients that have a higher risk of preterm or low birth weight, they think automatically, well, it happened to me personally. Patient thought that the person that was talking to them about periodontal disease, they were going to lose their baby. And so I think there's a better way to say it, obviously, without telling them you're going to lose this baby, because they're not going to lose the baby, or hopefully not. Obviously, there's been evidence of that, but being able to talk to the patients about this and not overwhelming them, but letting them know that it is a higher risk for them. So is really key too.
Yeah, the way I talk to my patients about it is I say, look, your body is spinning a lot of cycles on trying to fight the bacteria in your mouth. And your body's working so hard trying to fight the bacteria in your mouth that it's distracted and it's not able to give its full attention to your baby. I want to get all the bacteria I can out of your mouth so it reduces the inflammation and your body can spend its full time taking care of making that baby in the belly. And I think that's a nice way to kind of take it off from, especially we're not finger wagging and saying you screwed up and you're going to hurt your baby. And we're not saying this is so dire, your baby's going to die. But we're kind of saying, this is what I can help you with. This is what's going on. And we can really help take away some of the stress of fear in pregnancy of having complications, which can be really, really difficult. All right, let's see our next one. Here we go. So you may have noticed as we're going along that a lot of the citations at the bottom of your slides are from some doctors named Bale, Doneen, and Neighbors. Bale and Doneen wrote a book called How to Beat the Heart Attack Gene. It's got a very poppy name, but it's really good research. And so they have this great statement, but really what their mission is to show that there's more than just cholesterol going into and blood pressure going into the risk of heart attack. So they believe very strongly that periodontal disease and vascular disease feed into the heart attack process. And they recommend working directly with a general dentist along with your physician and cardiologist in order to help control your risk of heart attack and stroke. So I really admire these guys. Blair, you read their book, did you?
Yeah, great book. Lot of great research in it. And again, it all ties back to inflammation. That's the key source of a lot of the infections that are caused in heart attacks and strokes, Alzheimer's disease. It all goes back to inflammation, and we can help control that inflammation throughout the entire body, starting in the mouth. So yeah, this is a great book. I don't know if any of you have it, but if you don't have it, I'd recommend reading it because it gives a lot of great information and a lot of insight to it.
Yeah.
They also have a course
Oh,
too,
yeah,
that's
yeah.
really good.
One thing this statement also mentions is endodontic abscess. So that's another thing that, I mean, heck, I had it last week. My hygienist said, Dr. Sasse, you might want to take another look at this patient. They've got a pimple on their gums. Wink, wink. Went, oh, shoot, I missed it. And I went in there and looked and I said, you got to take a PA this tooth. There's a problem here. And it was a tooth we, put a bridge on 5 years ago. And lo and behold, it necrosed, and it was tooth number 6. And as we all know, that's in that danger triangle up here where the blood flow returning to the heart goes through your brain before it gets there. It does not go through the liver first. So an endodontic abscess can cause a brain infection in that area, especially in any area of your mouth, but in that area especially. And my hygienist is the one who brought it to my attention. Those endodontic abscesses are also related, are now being correlated to heart attack and stroke and other kinds of systemic disease. So when we're catching those things and treating them, any kind of infection in the mouth is bad for the body. All right. Now, this is one of my favorite slides. Often I get through taking a CE course and I go, well, this is very nice. I like all this information, but I have all these things in front of me that are going to stand in my way in order to actually take this information and make it actionable. One of the things I worry about as a dentist when I hear, well, yeah, everybody who's at risk for heart attack should partner with their medical doctor and their dentist, and everybody should get together and hold hands and get them healthy. I know we all know that there's a lot of barriers between us and the medical community. One way that we can really motivate our medical people is by talking about money, unfortunately. But we can also motivate our patients. Now, this is a study that United Concordia did in 2014. And United Concordia is an insurance company. So they're not going to try to make something up in order to make something look good. What they're trying to do is figure out, how do we save money as an insurance company? So they looked at people who got their periodontal disease treated and completed maintenance. And this study, I read it. You can copy paste that PDF or link in there. It's just a one-page report on it, the white paper. But by completing maintenance, they mean they've been to at least 7 periodontal maintenance visits. So these are well-controlled perio people. Saved $5,681 on patients who had stroke, $1,000 on those who had just plaques in their arteries, not even had an event yet, $2,840 on members with diabetes, and $1,477 for outpatient drug costs. So when I see a patient who's taking metformin, glipizide, Lantus, all these medications, I know that they are spending a lot of their own income trying to control their diabetes. So if I can help control their diabetes through their gums, I know I'm going to save them money, which is really exciting, especially in, we work within a profit-based healthcare system in the United States. So if I can benefit my patients not only in their health, but in their wallet, I mean, I don't know anywhere that SRP costs $1,400. So if I can save them money by treating them, I feel much better about what I'm doing. Also, $2,400 saved for patients who were pregnant, and they credit that with the reduction in preterm birth rate, which is really cool. Angela, give me the next one, would you? Okay, so this is a great one too. Same study, same insurance company, and they're talking about the reduction in hospitalization. So this again goes back to hospital beds, ventilators. The stress on our healthcare system right now is immense. So 21.2% reduction in hospitalization with United Concordia members who had strokes if they're completing their periodontal maintenance. 28.6% for members with heart disease, and 39.4% reduction in hospitalization with diabetics. Wow. I mean, it's not like, oftentimes I'll read a study and they're saying, oh, this composite's way better. And I read the study and go, it's 0.8% better. 0.8, who cares? I mean, might be misty that day and it's 0.8% better or worse. But I mean, almost 40% reduction in hospitalizations with diabetics who are well controlled is bananas. We should all care about that. And even if you pop out 3 numbers from these slides we've given you today, and just remember, I'm not going to tell you which 3 numbers are most important to you, but if you remember a couple numbers that you can give out to your patients, specifically if your patient is an engineer, a doctor, a pharmacist, a nurse, people who like numbers. I've seen that make the difference between someone blowing me off and saying, I'm not going to treat that, and someone who says, I'm motivated to do that. I want what you have. What do you want? What do I need to do? I'll do anything in the world. Let's fix my problem. How about Blair? How do you feel about these numbers?
No, I think it's great. I think actually having these numbers makes it more believable because you hear about it, but them being right in there, it's incredible to see the not only cost savings to the patients, but how much we can lower the hospitalization of these patients. One of the things that I find when I'm coaching hygienists and coaching doctors is the reluctancy to diagnose periodontal disease or to complete scaling and root planing on patients because of the cost. So I always look at it and go, you know, as a professional, our job is not to determine how much a patient makes or how much they can afford, but to treat the patient. So I always look at it like, you know what, this is free. How would I recommend this to this patient? I don't look at, you know, if they have insurance, if they don't have insurance. I diagnose in the state of Colorado, mind you, I don't know if any of you are from out of state, but the state of Colorado hygienists can actually diagnose. So I diagnose as needed by the patient, and I diagnose it early. I would rather them get the periodontal treatment they need early than waiting for those numbers to get worse, the periodontal condition, the bacteria levels to go up, and maybe having a different conversation with the patient about whether or not they're going to lose their teeth, because we're partners with these patients. So being able to partner with them, and that's the next slide, which is in education.
Yeah. Beautiful transition, Blair.
Yes.
So we talked a lot about statistics and mouth-body connection. I hope you all understand how important information in the mouth is with regards to our physical health and the rest of our body. Now we're going to get into how to talk to our patients. And Blair and I have already talked a lot about this so far today, but if you guys have any specific questions about patient communication, we love to see them. So please pop them in that chat box for us. Blair, how do you talk to your patients about the mouth-body connection?
Yeah, the first thing I'm going to do is look at their health history, even before they come back. The first thing, and I know that a lot of us look at like, oh, does the patient need to be pre-med? Are they allergic to latex? I think those are things that stand out. But besides those, we really need to focus on their medical conditions and asking the patient, getting more information from the patient about their medical conditions, reviewing their health history, because we all know that they may not put it down, or it may have been overlooked. So reviewing it with them is really, really key, because it gives us a lot of information to go off of. Asking the patients too, have you ever heard of periodontal disease? Bone loss, using really key phrases, and asking them if their parents, do their parents still have all their teeth? Do they have dentures? Have they ever been told they have periodontal disease? So that'll give us, obviously, that it is hereditary. I think everything in life isn't, they can blame it on their family, which is nice. No, but it's really important to look at the medical history first off. And it gives you an icebreaker with the patients as well. Once I've done that, that's how I start the conversation with the mouth-body connection. There's usually always something in the medical history that will start that conversation off and leading it into the assessment that I'm getting ready to do on the patient.
Sure. I mean, I would say, I'd be surprised if it was less than 60% of my patients over the age of 50 are on at least one blood pressure medication.
Mhm.
So I think that's a really good open door when I review their medical history with them and say, we've just sat down and I say, well, I see you're taking metoprolol and, whatever else for your blood pressure. It sounds like your doctor's trying to help you prevent heart attack or stroke. Do you think that's true? And they go, oh yeah, they're always on me about my blood pressure and my cholesterol. And okay, well, did you know that I can help you prevent a heart attack or stroke as well? Because you're way more likely to have one if you have active gum disease. That's an eye opener for a lot of patients. Patients who have polypharmacy, meaning they're taking 8 zillion medications. Say, look, I can see there's a lot of stuff going on for you. I feel confident that if I help you control your gum disease, your risk will be lowered. I hope, because I never say stop taking your medication. That's the worst thing we could possibly say. But I hope that by taking really good care of your gums, we might take some of the pressure off some of these other systems in your body. And you might be able to talk to your doctor if everything looks better about reducing some of these medications. So I think that medication portion is one that I see as a really good, easy way to open that door and get in and say, okay, blood pressure, the reason we care about blood pressure is heart attack. The reason we care about gums for you might be heart attack. I have patients whose spouses are in memory care, or they have they'll have particular needs about, oh, I need to make sure that my blood sugar is okay before my appointment. All of those things are little doors that will open that you can say, oh, did you know that's correlated with gum disease? I'm going to check you for that today. So listen along with me. And Blair and I talk a lot about framing the periodontal probe because we don't want to keep our patients in the dark. So whenever I start probing a patient, I say, listen along with me. When you hear 1, 2, and 3, everything's normal and healthy. 4 is not so good. 5, 6, 7 is a problem we got to talk about. I'll also note wherever your gums bleed when I touch them, because healthy gums don't bleed. You notice I said that very easily because I say it like 13 times a day. Helping your patients understand what their periodontal condition is more important than having them understand how it links to their body, but it's going to be a great way to help them understand how important it is to treat. So the keys here are keep it simple and to the point. I do not belabor the point about low birth weight to a 50-year-old man. He doesn't care. Say it in less than 2 minutes, be compassionate, and make it about them. So tailor that information to the person who's sitting in front of you. And again, it's not about lecturing, wagging the finger. It's about, I'm here to help. This is what I can help with. This is what I'm here for, is to help you.
It's a partnership. It's an absolute partnership. So there's limitations that we ourselves can do at home on our own teeth, just like our patients. And mind you, I know that some of us take instruments home and clean our own teeth. But besides that, patients hopefully don't. But being able to really let them know that this is a partnership. I'll help you with your home care and giving you some ideas to decrease the bacterial load. But unfortunately, that bacteria is going to get in those areas that you can't reach. And that's where I come in. I'll come in to help remove that bacteria and lower the bacterial load in the mouth. Building that trust, I can't say it enough, with the patients, and obviously going over home care. If you wouldn't mind, I'd like to get into just quickly some adjuncts that I like to use for periodontal disease. So obviously we're going to probe the patient. I probe the patient every single time they come in because they do change. And we utilize lasers for bacterial decontamination. I absolutely love them. It's not a cure for periodontal disease. Unfortunately, there is not a cure for periodontal disease. Ultrasonic scalers, I use that in conjunction with hand scale. Everybody uses a different ultrasonic, but I prefer a slim line for most procedures. And irrigation, I like using irrigation, and I recommend fluoride on every single one of my patients. Every single time they come in, I recommend fluoride. I'm going to do whatever I can to reduce the bacterial load, and it's not our job as hygienists is not just to be the cleaner. You know, I hate that. Our job is to help keep that patient as healthy as possible. And being the extra two eyes for that doctor when they come in or getting ready to come in and do an exam, look everywhere. Look at the teeth. Is there any suspicious areas? Is there any fractures? Is there any abscesses? Looking at the x-rays for bone loss. Detecting this early and treating it early is really big, but it's a partnership with not only the patient, it's a partnership with the doctor as well, to get this patient healthy.
Yeah.
And then referring to the periodontist, that's a huge one for me as well. I can't do what they can do. And I want to, if the patient can't keep it clean and I can't keep it clean, I'm going to refer that patient to the periodontist. As a matter of fact, I refer all patients that have residual pockets of 5 millimeters or greater. And again, I know it's different with every doctor and every hygienist, but for me, every patient that has residual pockets of 5 millimeters or greater, I'm going to refer to the periodontist. And most of our practices have a periodontist that comes into the practice, which makes it really nice to be able to partner with them as well to keep that patient healthy.
Yeah, absolutely. I refer to my hygienists in my office as the prevention specialists in my office, because you guys don't just treat gum disease. You prevent caries by the use of fluoride treatments and just by keeping the teeth clean and encouraging the patients in their plaque control. Again, I think it probably depends on the state, but at least in Oregon, hygienists are also doing oral cancer screening along with dentists. So that's really important. And then one adjunct that Blair didn't touch on yet is salivary diagnostic testing. So it's a really exciting new field in dentistry, is to actually spit in a tube and have tests done on that saliva for DNA. There's two different things that you can test in that DNA. One is the DNA of the bacteria themselves. So you actually know how much AA is in there, how much P. gingivalis, T. forsythia, all those. You can get the mix and know how to attack those better, kind of on a personal basis with that patient's mouth flora. And the other is actually to test the patient's DNA and find out if they have higher risk genes for inflammatory problems. So it's really exciting that we are able to get deeper and know more about the patient. Instead of just seeing the result, which is the pockets and the inflammation, we can actually start to know more about the cause. I tell my patients with perio, it takes two to tango. You need the bacteria and your immune system needs to react to it. So now we can actually identify both of those things and know more about our patients and treat them better.
Yeah, thank you. The oral DNA is what we use for salivary diagnostics, which is really great because it does, like you said, it does show the different types of bacteria that we're fighting against. So I don't use it for a diagnosis or an assessment. I use it for information to help treat the patients, to help me treat the patients further. Can I use bacterial decontamination more often on these patients because they do have higher levels of more aggressive bacteria? These are really great tests that we can use to help us treat the patient. Yeah, thank you for mentioning that.
And we got a great question from Kathy. How do you talk to patients about the difficulty with using flossers? Oh, there's a hot topic in hygiene. So first of all, I love to get the hand mirror in front of my patients when I'm talking about oral hygiene. And I have a little talk that I give where I say there's a triangle of gums between every tooth, and most people floss like this and only floss to the tip of the triangle and come up. And I want you to hug this tooth, shimmy that floss side to side like Donald Duck drying off his butt after the shower, get all the way down to the side of the triangle, come up, over, and all the way down to the other side of the triangle. So it gives them a little something to laugh about. And they'll go, but I use flossers. And I go, well, you can do this type of flossing. I just think it's a little more difficult. And I've got my drawer full of flossers and I pull one out and I say, so what you're gonna do is stick it down there, switch to the side, saw it back and forth and go down, and pull it over and saw it back and forth and go down. And they can kind of see how much more difficult that is to accomplish. So I generally tell patients, look, if you're not gonna use anything, use a flosser. But if you're willing to use traditional floss, I recommend using traditional floss. And then I generally also recommend a water pick to everyone. I know that's another kind of hot topic in things. But I tell patients that the patients in my practice who have the best control over their gums floss and use a water flosser. The patients in my practice who have the worst gums threw their floss away and only use a water flosser. So I say it's like the sprayer in your sink. You can't wash your plates without a sponge. You can't just spray and how the food comes off. You got to rub it with the sponge and then spray it off. So especially with my flosser type patients, the ones that like those floss picks, I'll say, if you're only going to use that flosser, I think it's really important that you also incorporate a water pick into what you're doing. So again, we're not, you know, wagging our finger at them and saying, you're doing it wrong, you've screwed up and you're a bad person. We're saying, if that's what you want to do, I want to add to what you're doing to make it more effective. All right.
Yes, it's definitely,
Oh, go ahead.
sorry. I was just going to say it's definitely better than not using anything at all.
Yes, yes. I found that most patients has problem with any type of flossing because it would slide in but not slide out. They would try to pop the floss out instead of sliding out the side of one of the teeth. So yeah, I think that's where showing a patient in the mirror how they're flossing is really effective. And then some patients will go, oh yeah, that's all well and good, doc, but I have all these really tight contacts. Well, that's where I might start introducing one of those little go-betweens brushes. Get creative with patients. Give them a floss handle if they have you know, mobility problems. I like those Y-shaped flossers instead of the U-shaped flossers. But if you have little samples of these things around your office and you can actually show someone in the mirror, I think you're going to get a lot more buy-in from your patients. All right. What are you using for your irrigation and what code do you bill? Does insurance pay for it? Fabulous question. I use chlorhexidine, and I think we dilute it 50-50 from the percentage that it is. And I have a machine called a dual select that'll actually pump the chlorhexidine mix through my Cavitron. So it's actually vibrating it into the pocket, which I think is most effective. There are lots of great studies on irrigation that show that it is effective, especially during SRP. I don't know the code off the top of my head. Do you, Blair?
I believe it's the 499. It's a generic code.
Okay. Yep. And then in my office, we've chosen to charge $10 per quadrant. So it's not very expensive to get my patients to do it. Some insurances include irrigation and bacterial decontamination with laser in their fee for SRP. So insurances won't, in my region, insurances don't usually pay for it. They'll just say, well, we have a little higher fee for SRP and that's included. Some include the irrigation, but not the laser. Most of my patients do pay out of pocket for that treatment. And then we've just tried to work on finding a comfortable spot for my patient population in terms of the cost. And then Amy has a question. I also tell patients that flossers are helpful for dexterity purposes and can be convenient for on the go, but very important to alternate. Yeah, I love that. Yep, I love. Please keep some flossers in your purse. Keep them in your cup holder. Floss at red lights. There's no such thing as too much flossing. So keep at it. That's a great suggestion.
Yeah, real quick on the flossers. If you're having the patient slide the floss out because the contacts are really tight, that's fine. But if they're having problems with it shredding, have your doctor check if there's fillings around or maybe a fractured tooth, because that can obviously shred that floss, and it's a good indicator for that something else is going on besides just maybe a tight contact in there.
All right, great. Well, I think we're done at 5:30, right? I believe
Yes.
we are. And we're at 5:29. So if anyone has a last minute question, please type it in there. But Blair and I both love hearing from you guys, and we have some resources as well. So there's the Bail and Donine is baildonine.com. There's the How to Beat the Heart Attack Gene. AHA for Life is the American Heart Association program. And there's another link down there from the ADHA in terms of oral health. So please check all those things out. There's tons of information. I even just go on PubMed and look for periodontal disease plus whatever condition. And you're going to find some articles that pop up that you can read yourself and find out the most recent research on what's going on. All right. So like I said, Blair and I love to hear from you guys. My email is sasse, S-A-S-S-E, and then E, because my real first name is Elizabeth. Okay, so Sasse E at pacden.com. My Instagram is at Dr. Sassafras. It's public. You guys should I'd love if you do follow me. It's all food and my cats, so not much teeth. And then Blair is down there. She's Hanosh B at pacden.com. We absolutely adore hearing additional questions over email, so please do not hesitate to ask us. That would really make our day.
Yeah, and thank you guys, everybody, for all you're doing out there. We really appreciate it, and I know your patients do. And I know it's been several, I guess, tough months with COVID, but we are part of the healthcare industry, and our heart goes out to every single one of you. So thank you all for what you're doing out there. You really are truly making a difference.
Yeah, thanks to you guys, and keep up the good fight.
Everybody, your CE certificates will be mailed to you as long as we had your name in there properly today, so we could make sure that you guys were here to attend. I'm also including my email, which is martinan@pacden.com, which is in the chat as well. In case there are any hygiene students or hygiene program directors that are with us today, please feel free to reach out to me. We're actually creating some content that's going to build on this presentation that follows the same guidelines. As you can see, it's quite a lot of information to have at one time. So we're going to be doing a series on this. And if you're interested, please shoot me an email and we can get that lined up for you. Thank you everybody for attending today, and you'll be receiving your CE certificates in the mail. And Dr. Sasse and Blair, thank you so much for joining us today. You guys are a super awesome dynamic team as usual.
Thanks, you guys are a pleasure as always.
All right, everybody.
We have a good time.
All right, bye.
Thank you, it was great.
Thank you so much for attending.